Hello, everybody. Welcome to your Montgomery County update. Today, Jeff Smith, our sheriff, and I are coming to you with some of the latest information and actually kind of an anticlimactic finish to the day. We were here Friday talking about, the expectation that the governor was going to make some announcements. The governor did today. So we're going to talk about that, give some reaction, and also give you the update on the latest numbers. We actually have seen from last week to this week relative to the last probably 6 weeks, a leveling off of the numbers. So we had 131 new positive cases this week, and that was just up 3 from last week's 128. So you actually seen the governor talk a little bit about that too in his remarks today about a leveling off of new cases. So, still a lot of cases in a week, more than we've seen at any time during the spring, but at least we didn't see a dramatic increase this week. And then secondly, just to go through the numbers quick, we're now up to 722 lab confirmed positives, 131 this week. The fantastic news is 535 patients have made a full recovery. We are actually 161 home-based monitoring and isolation right now, 9 under medical care, and 17 fatalities. So, also just to give you a scope of the amount of work that's being done in our public health department, as well as, with some of the folks from New York State, there are 650 people being quarantined and monitored. So that's quite a bit. I think that might be probably, I believe, our biggest number yet. So there's a lot of work going on, but the good news is I was certainly, I'll be honest, I'm completely surprised. And I know we all were pretty much thinking this, that we were going to head into a yellow or an orange zone today, especially when you look at the positivity rate and where that's been over the last week and 10 days and some of the other metrics. But to my surprise today, we were not included in a yellow zone. We were not included in an orange zone. And actually, the only area within the region, the Mohawk Valley region, that was included was the Utica-Rome area, which certainly there's a lot going on out there, but somewhat distant and separated from us. So, and I just actually was able to talk to the governor's regional rep about, why exactly, we were not. And the big reason is the hospitalization rates and the hospital capacity. I spoke Friday about my concerns about hospital capacity. We had some good talks with the folks at St. Mary's. They are doing everything they can to work on a regional basis to make sure that, our greatest fears, which is people having to go out of the area for care, does not happen. And they've been doing a great job. And right now, with the way things are right now, we're okay on capacity, and that's what has kept us out of a yellow zone. And the big reason for that, that a lot of people are going to be interested, is that allows the schools to stay open without that 20% testing requirement. So that's my reaction today. I'll be completely honest and say I'm shocked based on the numbers. But what really helped us stay out of a yellow zone was the ability to treat sick people. So I think it's important that metric is being taken into consideration, and as we'll be able to move forward like we normally have for the last few weeks. Obviously, to still remind people to. Not just because of COVID, but flu season as well, to wear your masks, wash your hands, and do all that good stuff, the social distance. So that's my spiel. Sheriff, how's things been over the weekend? Anything new, crazy to update?
No, we're in pretty good shape. Pause complaints have actually slowed down a little bit. There's a few here or there. We've made it past that Thanksgiving scare, right?
Yep.
And now we're approaching Christmas and Hanukkah and Kwanzaa.
Yep.
So we just got to buckle down and try to get through that holiday season, and hopefully, as we level off, we'll be okay. But it's good news to not be in the yellow or orange, that's for sure.
Absolutely. I know there's probably a lot of parents out there that are very thankful that.
They always Amsterdam's on remote.
Yeah, so we do have.
Right?
Yeah, and that's the thing. Again, I talked about it last time. If we're not in a yellow and there's a testing requirement, the schools and the superintendents, what they've indicated to me is they're going to do everything they can to keep their schools open. And what they want to do is try to, make their decisions based on the facts on the ground and logistics rather than just fear for fear itself. So you'll see where there are schools closed in the area. Really, a lot of times it has to do with positive cases, people, the close contacts being in a quarantine situation, and really just not having the people to keep the school open. So you're seeing that in Amsterdam. You're seeing that in, certainly in some other schools in different counties. But that's the way it's going to be moving forward. It's going to be handled on a district by district basis. I know in talking with Sarah, there's some concerns, related to schools as far as moving forward and keeping up with the tracing and those types of things. We're going to try to get the public health department a little extra help. We have a board meeting tomorrow night. They certainly need it and deserve it, need some relief.
As
Right,
always, you encourage calls, right? If
yep,
it's not something that's a
yes,
drastic emergency, to call your office, our
yep.
office, EMO, and
Mhm.
Rick Sager's office, and
And
we'll
we've
try to.
actually been getting some of those calls and following up on them. But like Nancy and Morgan and folks in the executive office have been helpful, and you've been following up with call after call since the beginning. So um, yeah, I mean it's kind of an anticlimactic end of the day here. I was expecting that we were going to be looking at restrictions and full school closures and things of that nature, but
That's why we pushed this back today.
exactly. Oh
Yeah,
yeah, that's probably yeah.
yeah,
We
letting people
we were
know.
waiting on the governor's press conference because I wanted to make sure we had the
Yeah,
most accurate information, and his got pushed back, and they had a number of things going on in Albany today. So, but that we waited, and actually it was good news. As much as I thought we were going to be yellow or even orange, it's good that we're not, so we can keep moving forward and not have really big impacts to our economy or um, our school districts. So with that said, I mean, we'll take a few questions, Morgan, or any questions we have. How are we looking today?
Someone had sent a message in regards to if postal workers are supposed to wear masks.
Postal workers? I would believe so. I don't, I would imagine it's they're walking down a street and nobody's around versus when they actually come close to somebody. I know that my postman that I've seen has been wearing a mask.
So strange. We have the highest rate in the state right now, don't we?
Highest, I mean,
Finger
we've
Lakes, I think, right?
We've had some high rates as far as the testing. I know the 3-day average in the Mohawk Valley region was up in the ballpark of 9%, and that's why I'm so surprised. But again, I went right to the governor's office for some answers, and really what has prevented areas within the Mohawk Valley outside of Utica and Rome are the capacity at the hospital. So and the capacity within the region. So. The decision was made that we still have the ability to treat people, and we're not at that point where we need to go into a zone. So that's how that decision was made, even despite of the rates. But I think, and I've said this all along, and I've had a number of conversations with people that it's one thing just to talk about positive cases, but you need to talk about how many people are getting sick and what is the capacity to treat people that are sick. And I think that capacity to treat people that are sick is being taken into consideration almost at the top of the list. So that's why, I'm certainly surprised. I mean, I'm not going to lie, I'm very surprised, but that's the reasoning behind the decision.
Our school's going remote.
Right now, that'll be a district by district decision. So right now, they do not have to go remote. Just because we have a yellow designation, we don't have any designation today, does not mean it can't happen in the future. So I would say, you know, right now, we're seeing a leveling off. We're not in a zone. So the schools will be able to operate if they logistically can operate. So that's going to be a district by district decision. There are some schools that are open and there are some that are closed, and that's based on most of the time not having the teachers and the staff to keep school open and running.
When will Montgomery County be receiving COVID vaccine?
So shortly, but that's mostly for the nursing homes and those frontline workers. There's a phased-in approach. We can share that information on the website, but I would caution people. I think, you know, the Mohawk Valley allotment was, in the thousands. It's not, we're not seeing mass vaccination yet. Right now, it's going to be very targeted to those first selected group of people. We'll post that stuff, on our social media, but you're not going to see widespread vaccination still for some time.
What does a hospital have to be at to be classified as yellow or orange?
The percentage off the top of my head, I don't have handy, but we can share that information. But it is up. I know red is at when you're heading towards 90. I think orange was 80, and I want to say yellow was 70. So the good news is we haven't met those thresholds yet. But there are, this is all being done at the state. These formulas that have been derived. Much of the folks alongside me in the control room. We were just we'll get more answers today at 4 o'clock on our call. But right now we seem to be in pretty good shape. So we'll share some of that as information online as well.
Is there any chance of a shutdown?
Well, the governor talked about it today. If you get to red, that is essentially a shutdown. So that's why, these color-coded steps are designed to prevent that. Based on what we're seeing right now, that appears, as a small chance in the near future for sure. So that's a good thing.
How will COVID vaccines be distributed and administered in Montgomery County? How will people know if or when they are eligible to receive the vaccine?
Sure. As we get the information, we'll let people know. Right now, what you're going to see is vaccination being done, at our nursing homes and hospital, and that'll likely be done in-house. You're not going to see widespread vaccination right now. And as we get more information, we'll share that with the public. But right now, it's really going to the most vulnerable and those people that are frontline workers, especially in the nursing homes.
And that's gonna be controlled by the federal government and the state, right?
Yeah.
We won't have any say in how
I mean,
that gets deployed.
we'll certainly be a partner, and I know Sarah has had a number of conversations with the state, but the state is very much rolling it out and in control of it, and will utilize the various resources not just within the county but within the region, and that's storing it. One of the vaccines has to be stored at a very cold temperature, and those facilities are in place, and there's a pretty detailed plan from the state, but we're going to essentially partner and assist, and that will be likely dominated by the
That's
state.
good to hear that we'll have input though.
Oh, absolutely.
Yeah.
Absolutely.
Why is it that the numbers are insane and we stay open, but when the numbers were tiny, everything was shut down?
It's a very good question, and I think what I've said to people, because I've certainly thought about that, is back in March, I think the thought process was very much it was unknown. There was a lot of unknowns out there, and it's like that old saying: if you could go back in time, knowing what you knew now, and go back to
We're
that.
better at managing it now, right?
Yeah, I think we've learned a lot, along the way. And again, I think, what happened in upstate New York was largely a result of what was happening in New York City. New York City was the epicenter of the world at that point as far as COVID outbreaks. And so, the state went into full shutdown mode and then gradually reopened. I think I would argue that if the governor had the information now that he had back then, maybe it would have been a different scenario. But I think now there's a much more detailed rubric for determining these zones. Again, the hospitalizations and you've seen the stay in hospitals shorten, the therapeutics and the ways to treat this are better. So I think it's a very different situation. This virus is something new, and there was just a lot of unknowns out there. So I really would say that's the biggest difference.
Have the nursing homes been put in a lockdown again? Fulton County has been having problems with positive cases spreading. How are the numbers in Montgomery County?
So nothing that's out of the realm of ordinary right now, I would say. I mean, we have a couple of nursing homes that have more cases than others. It appears, based on the reports and the briefs that I get, that they're being managed, and there's a lot of testing going on, and they've been dealing with this now for many months. So I don't know of any as far as in full lockdown mode, but I do know there's a couple nursing homes that have had to really ramp up their efforts to contain and prevent people from getting sick. But
And the visitation is like very restricted,
Yeah.
if any,
yeah,
depending on the home and stuff.
exactly. So it's again, we don't have in this region we had the one situation up at the Fulton Center that was really got out of control.
Yeah.
And that was early on. We haven't seen anything like that in either of the two counties. Again, there's been cases, but it seems to have been handled. It's been managed. It hasn't gotten a lot worse. And I would say that related to cases. We're getting a lot of cases from people going to their doctor, getting a test, having it come back. That's one of the notes that I was given today from Sarah, is that really it's across the county, and you're seeing it in the usual suspects that we've been talking to all along: nursing homes, travelers, community spread. People just going to testing sites, people going to their doctors. It's pretty much all over the board.
If a spouse is quarantined because of symptoms without a test taken yet, does the family need to quarantine if they're not symptomatic?
I would say the best thing, and that goes back to that sheet, and Morgan, maybe we can share it again. Isolation. So isolation keeps someone who is infected with the virus away from others, even in their home. So I think that's the safest bet to go. I actually know a person that's in that exact same situation, and I would recommend that same thing, is that, if someone is awaiting the results of a test and is in a home with a family and there was a reason you had that test, then it would be a good idea to isolate yourself.
Can you describe exactly what the hospital capacity is now at St. Mary's as of today, and what would a yellow zone hospital capacity look like?
I don't have those specifics with me. We get pretty periodic updates from the hospital. We'll share that on the page, and just make sure we get that 100% accurate. Just make a note to make sure we do that. And also, one of the things that I'm wondering and really going to ask on my control room call, is it only St. Mary's, or is it including Fulton and Montgomery? Is it including Fulton, Montgomery, and Schoharie? Is it the entire region? Those are questions that we haven't had answered. So I can tell you what St. Mary's is, but also it might be the capacity within a broader area.
Because there's a lot of people in the western part of the county that will also go to Little Falls and
Correct.
Cooperstown.
Correct.
And then the northern part will Nathan Latour, so.
Yep. Yeah. So you have some going west, you have some going
Yeah.
south.
Yeah.
So that's actually, we haven't gotten that detail as far as how that's computed
That'd make
and
a
what
big
the
difference.
formula is. Absolutely. And that's why I was a little concerned about our numbers in St. Mary's, but I was also in my call with the CEO of St. Mary's just at the end of last week. They're really coordinating regionally with the other hospitals to make sure that, if they can't provide something, that they can get someone into another hospital. And that certainly was really good to hear. I assumed that that's what they're doing, but, to really hear that is something they're really proactively working on. He reiterated to me that, the last thing they want, although it could be an option if things got really bad, is anyone to have to go out of the area for care, and at least stay within the regional hospitals that we have, being, Bassett, St. Mary's, Nathan Latour.
The numbers leveling off this week would imply that the spike was due to Thanksgiving. Would you encourage people to limit holiday gatherings?
Yes, I would say, and not even just holiday, if it's even Sunday football, and you're used to having, 10, 12 people over. I think the smaller the gatherings, the better at this point. It's the one thing you can do to try to help us stay out of the mode of restrictions. I think the last thing we want to see is people in our hair salons and, other in restaurants have to endure further pain. So I think, until this is over, a general rule of thumb is to limit your gatherings for sure. That's where you're seeing a lot of the spread, and it goes back to, some of these businesses and gyms. You're seeing very low rates of transmission at gyms and hair salons. You're seeing, really haven't seen schools as super spreaders, and a lot of it is because these places really have to follow the rules. Where you're seeing the transmission is at, private gatherings like that. So I would say absolutely, the smaller the better, and utilize Zoom and all those types of things to try to, do your best.
Is Liberty on the list of people to receive the vaccine at the same time as nursing homes?
I don't believe so, but I will double check on that. I think that was specific to nursing homes.
Someone commented, so limit Sunday football gatherings, good idea.
I'm just kidding. I'm saying you don't have a big one. Few people would be plenty.
And even if you have a couple people, right? You can still practice social distancing. You could still wear a face covering. You could still try to help protect yourselves.
Yeah, I'm just saying now's not the time to have 25
Right.
people over for the
A
Giants
monster
game.
bash.
Yeah, exactly. My last football gathering was 3 people, including myself. While Morgan's looking for questions, I would just say that, this is certainly some pretty good news this Monday. We're leveling off of the numbers. We're not in a restrictive zone, and it's still something that we're going to be working through. But I'm taking today as good news, Sheriff.
Yeah. It's good to hear something semi-positive
Yeah,
at
exactly.
least, right?
Exactly.
It has been nearly impossible to access COVID tests in Montgomery County. When will more tests arrive?
Certainly it's been a supply and a demand issue. I know that there's a lot of work. We're still working on having a new rapid testing site. Been talking to both hospitals. It's a lot of it is that demand, and I think hopefully with the things leveling out a little bit, their sites they've just been really full. I know again the CVS's and the Rite Aids locally have been booked. You got the Herkimer site. You got the site in Utica as well as St. Mary's. And also, your doctor, call your primary care physician. Usually that's been a very good bet for people. I know it's a challenge, but there's certainly options out there.
As crazy as it sounds, couldn't people be encouraged to quarantine before they travel to this region? Someone testing negative today can actually be positive and not show it yet. Not even safe to travel to different parts of the same county, no less to other counties or states.
Yeah, there's no doubt about it. The traveling has been an issue. It's been a source of transmission. I think the practical aspect of how you would enforce something like that is what's really been a challenge. The amount of travel cases that are sent into public health every day are very large, and it's just a matter of I think it's really a challenge, and that's why the governor's been focused on testing.
I mean, just think about restaurant going and shopping, right? People are traveling multi-counties over just to do that.
Yeah,
And that's not even a holiday gathering or
exactly.
something like that, so it's very difficult.
Oh, that's difficult, and even if you're talking about somebody from North Carolina or it's just very difficult to enforce.
Adjoining states.
Yeah.
Is there an anticipated date that nursing homes and hospitals will begin receiving the COVID vaccine? This week, next week?
Oh, it's imminent. I would imagine this week, if they haven't started already. I know some nursing homes have already started, so they're working up towards that. As you saw it today, they did the first person got it, but it's all starting right now. That's that first phase.
I think we're
good to go.
Is the first shipment of the COVID vaccine the county receives expected to cover all of the nursing home residents and high-risk healthcare workers in the county?
That's what we were told. So we'll see. We were told the distribution was based on those numbers. We'll see when the rubber meets the road, and probably next Monday we'll have a better idea if we have any shortages or issues, and we'll deal with that as it comes. But as of right now, I have not heard any issues or problems. But it's still early. We're good.
We're all set.
Sheriff, any parting words?
Same thing we say every week, right? Be compassionate about other people who may have problems that you don't, and let's buckle down and together get through this so that we can all get on the other side of it. And
Absolutely.
maybe get the vaccine to each and every one of us, and hopefully start living our normal lives again.
Yeah, and that's going to be the next challenge and I've seen a lot of funny memes out there about it, but it's a serious issue. Is right now the polling is about 50% of the people are willing to take the vaccine. You need to get to 70 to have it be what we need to get out of this. So we're going to be talking about that in the future. I certainly will be getting it. I'm looking forward to it. Do you have another question? Okay.
So there are 650 people in Montgomery County being monitored right now. That number seems a bit concerning. Has all contact tracing been done?
Yeah, I mean that's the work that's being worked on between our nurses at the public health department, but also as Sarah said last week, we're now utilizing some of the state resources to help keep up. Yeah, it's very concerning. It's difficult to manage, and that's what we were here on Friday talking about. is that, with each one of those cases and all those close contacts, it creates a lot of work. And that's why, doing your own part of trying to limit those contacts, and especially the ones that are indoors without a mask for over 15 minutes, you got to do the best you can. So, yeah, it's concerning. I mean, this isn't a perfect situation. I know that, there's a lot of counties, certainly around us, that are all experiencing the same challenges, trying to keep up with it. But everybody's doing the best they can. And again, if there's a specific issue and you have a problem, give my office a call, and I can always go down to public health and try to get an answer for you. That's happened a few times already, and we're going to continue to do that. Good. All right. Well, thank you, everybody. Hopefully, we'll see you next Monday. And there won't be any reason to have any special briefings this week. Just to recap, things have leveled off. We're not in a restricted zone, and that's a good thing. And hopefully, we'll maybe see things start to go down. But as you prepare for the holiday season, I would say, try to limit your numbers at your gatherings as you plan. And, that's something you can do as your part to try to reduce the impact that this virus is having on everyone. So thanks for tuning in, and we'll see you next week, hopefully.